Dear doctor, my father is 69 and he has white things in both his eyes. I don't know what you call them in English, but in Shona we call them tsanga. Those things are causing him not to see properly. One eye is almost going blind. I wanted him to be operated, but my siblings are saying those are common things in old age, and making him undergo surgery will not help. It is just going to make him feel pain in his old age. They also say the surgery is expensive. Is this true? If I decide to have him operated, will he be operated both eyes on the same day? Worried.
Cataract, in a simple terms, is opacification of the lens. When the lens matter get whitening, they become opaque, and that produces a condition which is known as cataract. Normally, in normal eyes, the crystalline lens is clear, and therefore it is not visible with the naked eye, unless if you have a machine, then you can see the lens. Otherwise, if there are no changes in it, the lens is not visible. The function of the lens is it allows transmission of light into the eye. That's one. Two, it focuses light which enter the eye onto the retina, so that whatever image which is captured with is transmitted into the retina. Three, it allows a person to see distant object and near object. The major contributing factor here is age. People live longer than what they were doing in previous years. And it's because of the longevity or the lifespan which has increased. Majority of people at the elderly age, they will be having cataract. For example, if you take a group of patients or elderly people, about 10 of them, one of them will have a cataract. And why it is also common is because of the also eye diseases contribute to formation of cataract, like diabetes mellitus. It is on a rise now. So many people live with diabetes these days, and therefore this as a cause of cataract increases the incidence of cataract in the population. During the pandemic of HIV, many people who were living with HIV had uveitis. Uveitis is another known cause of cataract. There are many causes of cataracts. One, which you may not know, is congenital. There are some children are born with cataracts. The cause of this usually is from infection from maternal infections during antenatal period. One of the commonest causes it leads to congenital rubella syndrome, which the child is born with cataracts bilateral. The other one is age. As I said earlier, the longer you survive, the more the lens becomes sclerotic, it hardens, and also whitens. That way, we call it senile cataracts if it is purely due to age. But there are also eye diseases, I have said, like uveitis, which contribute to it. Also, metabolic diseases, which are caused by diseases like diabetes mellitus. This also is a factor in causation of cataracts. Not to forget trauma, injuries. People with who are especially farmers who work in the bush. You know, in our environment, there is a lot of thorny shrubs. When they pass through with scotch cuts, sometimes those thorns hit the eye and damage the lens. One, it is the commonest cause of blindness in the world. Now, because of that, so many people suffer from it, and majority of them, those who do not get access to the health service, they remain blind until they die. Two, it is preventable. Once you operate the patient with a cataract, the following day after the operation, when you open the eye, the patient's the sight is restored immediately. The patient can see. But our people do not know that this can happen, especially those who in the rural. They are contented to say, after all, I'm old, therefore there's no remedy for me to be able to be assisted. But if we harvest those guys and bring them to the hospital, they'll be very happy because after the operation, their sight is restored immediately. The condition cannot be cured by medical treatment. What do I mean by this? There is no pill or tablet which you can swallow to clear the cataract. It does not start overnight. Gradually, the patient feels that he cannot see things at a far distance. As time goes by, the vision goes down up until now he cannot read. If you go further, you find now the vision is gone, he's left with the light perception only. So gradually the vision is lost in that way. Why do people do not then report to hospital? It's because these patients, they don't feel any pain. The factor which makes people go to the hospital, number one, is because of pain. If you feel pain, you know there's some problem somewhere. So you report to the hospital to find out what is this pain arising from. But with no pain and the vision just decreases slowly, they stay at home because they say there's nothing for them. 3, you find that for those who are driving at night, there is what we call glare. Glare is caused by scattering of light into the retina, especially when you drive and you have oncoming vehicle coming flashing on you. If you have cataract, everything blurs, you cannot see clearly. And this is one of the causes, if the patient is not operated, it's one of the causes that they stop driving completely because they are afraid they can cause an accident without them knowing. When you look at the lens, or at the eyes rather, you see a small white thing in the center of the eye, surrounded by black tissue. That is the cataract. But you only see them when it is mature, like that one there. Diagnosis of a cataract is very simple. You see with the naked eye. You can use a torch to examine the eye. You just shine a torch on the eye, you'll be able to see that round thing which I've seen around the pupil. Once you see that, then you know it is a cataract. But we as eye doctors, we go further, because there are some spots in the eye which are on the cornea, which are also white. So you have to differentiate between that and the white portion of the lens. We do that by using a slit lamp examination. A slit lamp is a microscope which is used to diagnose eye diseases. With that, if we are still in doubt, then we make the pupil wide by using medications, mediatics, to make the pupil wide. That will make the lens more visible than when it is just a small thing on the pupil. Cataract has lived with us since when the human being was created. Before, remember, even if I quote the Bible, Jesus used to treat blindness. That was kudara. Okay, then time came again. The method that they were using was very crude. It was called kuching. Kuching, the so-called doctor then could hit the eye to dislodge the lens. So the lens became dislodged, leaving an empty area where the lens was. Then the patient picks up and sees. That was coaching. But for a long time, we've been operating using a cryo machine, a probe, which at the end of the probe was freezing. After opening the eye, then we touch the lens and pull with that probe that lens, which is cataracts, and close. That was called intracapsular cataract extraction, because we are removing all the cataract, the entire cataract, including the capsule. But with time, technology improved. We now started cutting the anterior portion of the capsule, removing the nucleus. You clean the contents which was in, and then leave it like that. It was called extracapsular cataract extraction, and you close it. For these two, the first one, intracapsular, and this extracapsular, we were rehabilitating the patient by using thick glasses, +10 glasses. After that operation, you give the patient a +10 glasses. He was able to see quite reasonably. But again, with time, more things came into light. We started implanting intraocular lens, a small gadget, which is a lens we put inside the eye, close it up, and the patient amazingly sees very well with that. And this was called extracapsular cataract extraction with intraocular implantation. Then, having done this, now it was a matter of techniques now. With the time again, people became interested to say we should be doing more patients at one setting. Like in India, they would do 1,000 patients a day. So, how did they do that? They did it by modifying the way you do it, handling the cataract. Procedures like small incision cataract extraction led us to do quick, more cataract operation than usual. And it is in place right now, they are doing it. The other thing, after the small incision cataract extraction, we are now doing phaco emulsification. The process is the same, but the phaco, you use a machine which fragments the nucleus of the lens, sucks it out, and it utilizes a very small opening of the eye. The opening of the eye that you go in is very small, maybe 13 millimeters or so. Why then you use the lens that you use to rehabilitate the patient is also different. It's now affordable, which is put into a pencil and you inject it inside the eye, you plant it there, things becomes okay. Why phaco became very famous is the incision is very small and the healing is also quick, very, very quick. The operation per se is the same. But now, let's say it's a child. The same procedure which you will apply in a child, you need to put that child to sleep. Because a child, one, is afraid, so he will not be stable when we are doing the operation. For adults, we do not put them necessarily to sleep, but we inject a local anesthetic which makes the eye numb for that period when we are operating. And then we operate, and the patient does not feel anything. So you'll be talking to the patient at the time of operation. If he try to move the head, you tell him, don't move the head. You talk to him because he does not feel the pain, and while you are still working inside the eye. So the techniques depends on who you are doing. There are patients with the mental disease. When they have such a thing, you cannot trust that patient that if even inject make the eye numb, the patient may not cause any problem. Again, we go back to selection. Here is a child with both eyes with cataract. What we do with this kind of a patient is we operate both eyes at the same time. The reason is you don't want to subject this patient twice for anesthesia to put them to sleep. So if you have chance, do it both of them at the same time. For children. For people from Nguchen, the same. You are trying to avoid putting them to sleep again twice. But for normal patients, we normally insist on doing one eye. Why we do that is God gave us two eyes. If there is a problem in one eye, then when you tackle the other eye, you take a precaution, isn't it? You'll be knowing, I did this here, let me try to avoid that and do another way. 2, there are times when you can get infection. You don't know when the infection can crop in. So, to avoid that, do one eye at a time. So that if this eye gets an infection, at least the patient will have another eye which you take precaution again not to have an infection, a repeated infection. Two weeks or so, or after a month. After 1 month, already the eye would have healed. I'm just saying, for me, I take 2 months so that it is a complete healing. The wound has completely fused. That's the minimum time for the healing. Yes, they will need spectacles because I'll go back to the function of the lens. We said the lens transmits light, it focuses, and these functions are lost because the lens that you put in is a plastic lens. Yes, the light will be transmitted through, but the focusing mechanism now is not possible with a plastic lens. So for those who need to read, they will need spectacles to be able to read. Because after removal of the cataract, there will be no accommodation. Accommodation enables you to see closer for reading and doing signing, whatever. So you need to rehabilitate that back to enable the patient to read. And therefore, the spectacles becomes mandatory for those people who want to read. Once put, it remains there for life. For government setting, any patient who is above 65 years is a senior citizen and the treatment is free. Most cataract patients are above 65. So those, they pay nothing in government setting. Okay? Children likewise. Those who are under 5, they don't pay anything. So you see, the government has given you opportunity and you are not utilizing it. You see. Those who are school-going children, I think they pay a little bit, but not as much as for adults. If you come to private setting, like this one, our charges are controlled by medical aid. It's not just me, Dr. Jana, just saying, I saw a cataract, I will charge 1 million. No medical aid will pay that. You see? So we are controlled. Our charges are controlled, and we take that and send to medical aid. And we use that one to even those who do not have medical aid. We use the same charges, whether you are on medical aid or you are not. That is a private setting now. The burden of blindness is increasing, but the facilities where they get the services are still the same. They have been the same for donkey years. There are no new facilities that are being opened to be able to deal with increasing burden of blindness in the country. So this then translates to say that whatever we do is like we just take the tip of an iceberg, the rest remains blinded in the rural. Only those who can access us are those whom we tackle. But if you go into the rural, you see more blind people and more and more. Hence, the other thing that I would maybe say is about creating awareness to the people who are blind that they should not sit at home. Once they are blind, they should come visit a health facility anywhere. Health facilities, they are all over. It begins with the clinics in the village. It is a health facility. The nurse will be able to pick that thing and send the patients to centers where we deal with operation and assist patients.